Participating in No Shave November. That includes some of our own Creme 2 team, but they're not doing it to get out of shaving this month. It's all to raise awareness for prostate cancer. So this morning, I'm joined by Dr. Ray Lance to talk about the risk of the disease and screening. Thank you so much for coming this morning. And I also do want to point out that Dr. Lance is also an oncologist, which is, really important for this conversation.
Yeah, thank you very much. I really appreciate you having me here.
Of course. So if we could talk a little bit about some statistics that are pretty interesting.
Yeah, I think it's important that people understand that prostate cancer is a significant disease for men. About 165,000 are estimated to be diagnosed this year with over 29,000 deaths. And unfortunately, there's sometimes a misnotion about prostate cancer that it's not a serious cancer like, say, pancreatic cancer,
Sure.
where mortality is much higher. So I want the message to get out to our neighbors in the inland Northwest that we need to be aware and be screened,
so what
be
are
tested.
Sure, and so what are some of these risk factors that are contributing to these numbers?
Yeah. So the biggest risk factor is age, so being a man over 50, also African American race, and primary family history. So if you have a father or a brother with prostate cancer, you're at much higher risk and you should be evaluated more carefully. Also men who have symptoms, obstructive voiding symptoms, difficulty urinating, those kinds of things should be considered.
Is lifestyle at all a factor?
I think lifestyle is a factor, although there's a genetic relationship as well. Certainly, being obese, eating high-fat diet is not good. Also, we think there's a relationship with vitamin D deficiency, which in this community we have to be concerned about.
Of course. So what can people do to lower their risk? I know I've read myself that there's some confusion, a little controversy. I would just be curious to see what you see in your practice when it comes to detection.
Yeah, and unfortunately, preventing prostate cancer is difficult. We don't believe that there's any specific thing that a person can do to prevent it, although making your body healthier, exercising, losing weight, taking vitamin D, things like that are helpful.
Okay.
But I think in terms of early detection, we believe that it's very important that men have periodic testing. PSA blood test is the main way that we do that. It stands for prostate-specific antigen, and it's a test that can help us to understand if a man is at risk for prostate cancer and should have even further testing. And the studies have shown that if a man gets PSA screening, it does reduce or improves the probability that he won't die of prostate cancer in his lifetime.
So, so we talked a little bit about some of the screening. So how about some of the diagnosing? Because just to clear up that they're not one and the same.
No, great point. So yeah, so if a man gets a PSA test, it doesn't necessarily mean if it's elevated slightly that he has prostate cancer.
Okay.
So ultimately, the only way we make a diagnosis of cancer is a biopsy. So we have tissue. In our business, we say that tissue is the issue. So.
Okay. So with that, you would do an ultrasound, and I would like to get to some of the technology that you offer.
Yeah. So the way we typically diagnose a man, let's say a man has come in, seen his primary care provider, and been tested, and his PSA test is elevated.
Okay.
Then typically he undergoes an office procedure called a transrectal ultrasound and needle biopsy. Typically takes about 10 minutes. Patients tolerate it quite well. And that ultimately, those tissue samples are analyzed by pathology, and that leads to the diagnosis of whether he does or does not have the prostate cancer.
Okay, so before we wrap it up, if you could just talk quickly about the MRI fusion.
Yeah, so MRI fusion is a new technology that we're happy to say we have here for the only place outside of Seattle that has it. And what this allows us to do is to do a more accurate testing of the prostate. Ultrasound is good, but MRI is even better. And so the problem there is that in order to biopsy that, MRI is a big magnet. So taking metal objects in there is not happening. So what we do is we have a device that looks like a little satellite for the patient, sits over the patient, its own personal GPS satellite, and allows us to localize and find just the abnormal area in the prostate and then accurately biopsy it. So it means less biopsies and greater accuracy.
Okay. Well, no, thank you. That's very helpful that we actually offer it here in Spokane. We're actually going to talk a little bit more on Facebook Live to go a little bit deeper for what we didn't get a chance to cover in this segment because there's just so much. So thank you. And we will be back with more Creme 2 Morning News after the break.